Hello and welcome to Dragon Bytes, the pediatric podcast aimed at pediatric trainees or anyone interested in child health. I'm Asim, one of the hosts for Dragon Bytes and one of the pediatric trainees here in Wales. This week we're going to be telling you all about applying for and interviewing for the Neurology Grid programme. Dr Celyn Kenny, one of the newest hosts for Dragon Bytes, is joined by Dr Gemma Howells, one of the Neurology Grid Trainees currently working in Cardiff. So, let's get started.
Hello and welcome to our Grid Speciality podcast with Dragon Bytes. My name is Celyn Kenny and this is my first solo mission for Dragon Bytes, so please have patience and bear with as we get through. I'm lucky enough to be joined by Gemma. Hello Gemma, welcome. I hope you've got patience for me today as well to get me through this first podcast.
I think it might work both ways, Celyn.
So I've been fortunate enough to work with Gemma for the last 6 months in UHW, the Heath Hospital, Cardiff, and Gemma is one of our neuro-reggers. And she is on the grid, and she is going to give us her top tips today to try and make sure that all our listeners who have an interest in neurology, paediatric neurology, are in with the best chance to get that grid spot. So thank you, Gemma, for joining us. So we'll start with some questions. So Gemma, tell us a bit about yourself. Where have you worked so far with regards to your paediatric career?
So I'm currently actually ST7, I nearly said ST6, but of course it's September. And I think I've not really taken a conventional route to get there. So I trained in Leicester, did F1, F2 in Leicester, I did an academic paediatric F2, and then went and lived in Sydney for 5 years and did essentially ST1 to 3 in Sydney, but came back to an ST3 post in Bristol and then moved to Cardiff for Grid as of last September. So I've been here a year.
So I've learned something new about you already. I had no idea you'd lived in Sydney, and now I feel like I need to pinch all your knowledge because that's where I want to go. So I've learned something. So what drew you to neurology?
So I actually, from F2 onwards, when I was revising for the exams, I really liked clinical genetics, and I had fully planned to go into clinical genetics. And when I came back to the UK, applied for both genetics and peds. And in that process, I think I realised that actually genetics wasn't what I wanted at all. And in Sydney, I'd done some neurogenetics research, thinking about trying to get into genetics, and I'd done a neurology job. And I really, really loved that job and hadn't expected to, because I thought it would be really sad. I thought it'd be really difficult. I thought it would all be far too complicated to understand anything. And so really, I think that was probably a big turning point. And then I think the things that I liked about genetics were probably a bit misguided and are actually the things I like about neurology. So I think the things I like are that it's a really nice mix of acute and outpatient stuff, and just the variety of all the patients in different conditions. And it's just I just think it's really interesting.
So when did you start your neurology grid training?
September last year.
And you worked in Cardiff for that year?
Yeah.
Lovely. So how did you get onto the grid? What did you do in preparation to get that spot?
So I felt quite out of the loop, having been in Australia, and then although I was a Bristol trainee, I'd worked only in the NICU in Bristol, so I was in a DGH. I didn't really know how the grid process worked. I didn't know any of the tertiary specialty teams, and it was a little bit of a last minute decision, in that it all kind of came together and I was quite definite about it towards the end of ST4. Having said that, in hindsight, my CV was fully geared towards neurology. So I think I was just late to realise what I needed to realise. And I'd planned to do some research, and that sort of didn't happen around that time as well. But I think the fact that I'd planned to do things based on neurology was helpful for the grid application.
And as you said, obviously you had that interest in genetics, and they are actually very similar.
Yeah.
So that it's amazing how your past jobs can almost guide you blindly, and you fall into that specialty that you enjoy.
Yeah, like it was so obvious in hindsight, but didn't realise it until a couple of years ago, probably.
And what does Neurology Grid, what does that entail of?
As in the training process?
Yeah, the training programme itself for neurology.
So it's 3.5 years, which is a bit different to other grid specialties. And the issue I found with that is that when you apply for grid, you have to apply with enough years left on your training. So, but they don't mind about that extra 6 months at the end. So really, because you can only apply after your ST5 year, you only essentially have one chance then at applying for grid. Although you could, when I looked at what would happen if I didn't get it first round, you could do a year in neurology and then get it sort of retrospectively approved. So there are options, and it's not just a one-off chance. And then so in that 3.5 years, you have to do 6 months of adult neurology. And then for the other 3 years, it's all pediatric neurology. And it's a little bit, it depends on where you are and what services there are in your area. But like, it's quite likely that I'm going to have to spend some time in a different centre, just to get some exposure to some of the rarer conditions. And I'm going to do some CAMS clinics and some neurodisability clinics to feed into it. It used to be that you had to do a designed sort of neurodisability block, but now it's more competency based.
Oh, and what do you have to do with adults? That's my...
I know.
Because that's, as a paediatrician, it is a bit scary thinking about the adult world. Because I know a lot of trainees felt it with the recent COVID deployment to the adult world. So knowing that within, how does that tie?
I think you're supernumerary, and I think it's all about like learning about stroke and MS.
Okay.
So I don't think they expect you to be fully managing the adult medical ward, and they, from my understanding, is I won't be doing adult on calls. I'm going to be horrified.
No med reg.
Or I'll be an F1 or an F2 equivalent.
Put in
as
a
adult
cannula.
on calls, but not
Rewrite
no
a drug
decisions.
chart.
Yeah.
I'm sure you'd be able to do more than that. Okay, so are there any specific requirements that you have to achieve by the end of training?
You need to be competent with neuroradiology, neurophysiology, and a reasonable amount of genetics understanding. So I feel like those are almost like the 3 core subjects in and amongst the neurology knowledge. And then all the different areas within neurology, so neuroinflammation, epilepsy, movement disorders, neuromuscular problems. Probably I've missed a few, I'm sure, but sort of it used to be very case based, and you had to tick off the number of cases for each condition, and now it's more competency based.
So similar to the progress curriculum as well, so it follows out.
Yeah.
Okay, interesting. So what general advice would you have for trainees applying for Pediatric Neurology Grid?
So probably I would say speak to the tertiary team and get their inputs and let them know that you're interested, because I was just too intimidated to do that for ages. I just thought, neurology is really hard. I don't know anyone. They're going to think I don't know anything. Well, I don't know. I felt
makes me sad, Gemma.
I know, but it genuinely was a reason why I felt too scared to speak up about it. And it was only really the local team where I was working that gave me a bit of a nudge, and that was really helpful, and I'm so grateful that they did. But I think don't be intimidated about approaching people and letting them know that you're interested. Don't worry if you feel like you don't know much about the subject, because it'll be fine. And I think doing something a bit different, like if you could take a year out somewhere along the way from all of the other people I know that have been successful at Grid, most of them have had something different, whether it be a leadership year, a quality improvement year. I feel like potentially my time in Australia might have stood out as a maybe different career path, and I think it just makes you more memorable from the application and interview, and that extra time to have got more things done, such as research papers. And then I think of all the areas for neurology, research probably ranks much higher than education and leadership and those types of things. But whatever people are interested in.
So that's actually basically answered the next question.
sorry.
No, it's great. So how can trainees maximise their chances of getting an interview? So just being memorable, isn't it? And having something that makes you stand out.
Yeah, and I think commitment to specialty, I don't know, that's probably the area that I scored highest. I think I was lucky because I was planning to do a PhD at the time in neurology, so that was a very clear demonstration I was committed to that specialty. And as I said, in hindsight, all of my other stuff was quite neurology based. And then research, I think, scored quite highly, and I was lucky that I have got a few papers, so could tick off those quite easily. I don't have an MSc. I didn't intercalate, so I think those things obviously would have got more points. But I think it's much more research heavy than other areas.
Interesting. And was it, obviously you get more points for being the first author on those papers and things as well? Did that help?
Yeah, I can't remember. I think we did. And I'm sorry, I can't remember I wish I'd have written more down from the application form. I wrote down my notes from the interview afterwards, but not didn't keep much of a record of the application form. So I can't remember how it was scored. Certainly, if you approach your tertiary team, they would be able to help you.
And that can help then with improving your scores for the process then. Yeah. And I think it's really important. Advice I've been given from colleagues who've been through the grid process is to get that application printed off early, so you know where to get points. Yeah,
and if you're current, like I only looked at the application in my ST4, ST5 year, so in a way, I wish if I'd have been a bit more. I think if I'd have been clearer about what I wanted from an earlier point in time, I wish I'd have looked at it from like ST1, ST2, and then been quite strategic with the extracurricular things that you do. And I think that's probably pretty sound advice that I didn't realise for quite a while, that if you're doing an audit, make it a really worthwhile audit and make sure you complete it rather than just doing it for the sake of it. And it's better to do fewer but higher value things than lots of little things.
So say if you're an ST1, ST2 and you had an interest in paediatric neurology, how can trainees gain experience in that post? If maybe they're not fortunate enough to get a neurospecialty post?
I think if you could use study leave to come, certainly the team in Cardiff would be more than happy for people to come on, say, like a Friday when we have the neuroradiology meeting and neurology grand rounds, going to speak to the team. I forgot to mention actually the conferences. That was another thing I was too scared to attend, the British Pediatric Neurology Association conference, and there's a trainees meeting at that, and it's really, certainly now seeing it from the other side, it's really nice that when people come, and I would love to answer questions about coming to neurology, and I don't think I was always too scared to do that. So I think if you can't get a neurology placement, I think there are lots of little ways that you could get more exposure. And certainly if you've got a community placement, which everyone does have, then going to neurodisability clinics as a preference, because I found that really helpful. And that also actually I sort of briefly thought about neurodisability, but going to those neurodisability clinics, I really enjoyed them, but it made it clear that neurology was the one as well. So it's like I'm answering all the questions in a really convoluted way.
No, you're making my job nice and easy. I'm just like, we're going with the flow. So obviously, you would say it is necessary to have at least a bit, to have experience in the specialty, so you know what you're going in for.
I think so. I mean, I didn't have that when I was thinking about genetics. I think it was the process of applying for it and looking into it in so much more detail that made me realise that it wasn't what I wanted to do. And I think you have to have gone on that journey in some form, whether or not you've actually done a job in that specialty. I think they need to see that you've really thought about it.
And again, it comes back to commitment to specialty as well, which is a big part of the scoring process in getting an interview. So going on to the interview, the dreaded interview. What can trainees do to get ready for the interview? How can they maximise their chances on the day?
So the things, I thought it was a really fair, like quite a fair, well-rounded interview. So maybe it helps if I say what I got asked, because then that's essentially all the areas that you can prepare for. So I got asked to do a 5-minute presentation on the challenges of being a paediatric neurology consultant in the 2020s.
God, nothing could have predicted your presentation given
Exactly,
2020.
Yeah. Luckily, I chatted to one of the Bristol consultants who gave me a bit of an insight on some of the issues around training. And certainly, if anybody is applying for Neurology Grid, please get in touch, because I can give you a full lowdown of, with the shape of training affecting numbers of training posts for neurology, number of consultant posts. There's a national shortage of paediatric neurology consultants, so that's quite a big issue. So there's lots of things that I can let people know about regarding the future of things. And for stuff like, I think a lot of the presentations they ask for are around similar themes, or they'll ask it in a different way to get the key issues out. And then I got asked a clinical scenario, which I thought was entirely appropriate. It was a child with a VP shunt with vomiting and headaches. So that was, I thought, quite simple. I got asked about a colleague in difficulty, and it was essentially questions taken right out of that. The Medical Protection Society did that interview guide.
Oh, that
book that a lot of people. I wish I knew the name of that book.
And I got it on the top of my tongue. Like, I can see the book.
It's like called Interviews.
Yeah.
Yeah.
Yeah, I know the one. It's really got loads of colours on the front. Yeah. So that the guide to medical interviews.
Yes.
That is something like that. It is brilliant.
Yeah. And it was So reading that was good preparation. They asked me about a NICE guideline and how I thought I could change it, and it didn't have to be neurology based. But then they asked me for a neurology one, which was fine. But I'd read the guidelines relevant to your specialty, and not only the NICE guidelines but the RCPCH guidelines, and then an awareness of kind of hot topics and research in the area. So it's I felt like it was all pretty predictable, standard. There was nothing out of the ordinary. Oh, and then there were questions about what's your worst quality and how that could affect an MDT. Was what I got asked. So I ended up naming 3 bad qualities because I misinterpreted the question. And then
I won't make you do that show today. And I won't list mine. We'll be here all night. So resources you recommend for trainees would be that amazing book, The Medical Interviews for Trainees. NICE guidelines for your specialty. And anything else?
I would look on the BPNA website, because that will give you a really good idea about key sort of targets, a bit like the way with the RCPCH, you can get a clear idea of what's going on. But stroke is a big target from both the RCPCH and the BPNA. Cannabis is a big issue at the moment. Sorry, this is just off the top of my head. There are lots. Obviously, genetics is a really big and gene therapy is a big thing. So you could go on for ages, but BPNA website. I'm getting off topic again, aren't I? And just having an idea of current research and be able to talk about a paper in a bit of detail.
Good to know. Is there any way to structure answers to make them better? Would you say? I'd go by that book. I don't know about you, but that book helped me. Has helped me through many an interview. Yeah.
And definitely in my interview, the questions that were straight out of that book, you could almost see.
You can twist them.
Well, you could see their eyes glaze over, and I just gave a stock response, and they were just ticking it off. And I don't think they minded. I think they just wanted me to get out the stuff that I needed to say. And then I think it was other areas where you could be a bit more personal. Yeah, because it's hard, isn't it? As long as you're too prepared, then you just sound like a robot.
Yeah, it's good to have personality. That's what my mother tells me anyway.
Yeah. And I did my interview after nights, so I was a bit disinhibited, which I felt like actually maybe might have helped a little bit, because I was a bit more lively than I might have ordinarily been if I was
running on
nervous without the
adrenaline.
tiredness. I don't know. Yeah, that's not good advice, is it? Be really exhausted and don't get any sleep. This is not the best interview advice.
You can survive.
But yeah.
Fight or flight kicked in.
Yeah.
And that goes with neurology. So you've answered, we know about what questions come up now. We've gone through that with regards to commitment, especially, yet again, a similar theme. Just general interview questions, isn't it? And how long does the interview last for?
I think I was, because of the presentation, I think they give you either 20 minutes or half an hour to do it. So I think I was there for a couple of hours. One thing that is probably not, I mean, maybe I was just an idiot, but I turned up with no paperwork, ready to go. And there'd been an error with the emails, and you were meant to turn up with, your passport, your driving license, and a form. So I didn't have the best start to the interview. I was panicking about all these things I hadn't turned up with. Like, luckily I had my driving license with me, and I think I might have brought some stuff anyway, because I thought that was a bit odd. But this form that I needed was a bit stressful. But it wasn't my fault. But it's just one of those, I think, if you haven't heard or been told to bring stuff, I'd maybe double check, because the interview process wasn't as seamless as I thought it might be.
I always, going off track, but I always panic with an interview about where it is and getting lost.
Yeah.
Where was your interview?
It was at the RCPCH in London.
Okay, so that's quite, a lot of us have been there for courses and stuff. Yeah. So at least that's something that's easy to get to.
Yeah.
Okay. So just bringing this to a close, what is your top 3 tips to apply? And then what piece of advice that you weren't given would you give to a trainee?
Okay, top 3 tips. Don't be intimidated by all the other people applying for grid, or by other people in that specialty, or the process. And I'd go for it, even if you think your application might not be strong enough, you don't have enough points. I wouldn't be put off if you have an interest and you want to do it. I'd say go for it. Number 2, I think do something different to try and get a piece of work published. I think it's just too hard to fit it in amongst the standard working life, exams, competencies. And I think having a bit of time out, if you can, just really gives you the opportunity to do something different and get something on your CV that makes you stand out from everyone else. And number 3, contact the local team and get advice from the consultants who are in that specialty, and contact them early. And then what advice would I give that I wouldn't have done? Plan it from well. Don't have an epiphany in the last year before and apply in a slightly hurried way, or in a slightly less planned way than I think I would have liked to.
But you got there.
I know. But
and I think it does show everything does happen for a reason as well. Like, things happen and you end up in places.
Yeah.
Oh God, I sound like my mother.
Yeah.
Oh, well, thank you for joining us today, and I hope, I'm sure our listeners have found it very interesting, and I know Gemma's going to be more than happy to be contacted.
Yeah, definitely, please do.
Yeah, so we'll put Gemma's contact details up for you, and she can be found in the University Hospital of Wales, carrying the Neurology Reg Pediatric bleep, most days. So thank you, Gemma, and thanks for getting me through my first solo mission on my Dragon Bytes podcast. Thank you for joining us.
And I just wanted to say thank you to both Celyn and Gemma for recording that podcast for us. The advice there is super helpful. It's worth bearing in mind, as they have spoken about what's happening during the interview process, that this year, and maybe even in 2021, due to the COVID crisis, there might be very different rules as to how the interviews will be taking place. So make sure you check on the Royal College's website for a more up-to-date information about how the interviews will run and what stations to expect. That's all for this week. Thank you for listening to Dragon Bytes.